All right, time for the weekend download. Today, we're going to try to keep you up to date on the latest health headlines relating to the pandemic. So let's bring in ABC's chief medical correspondent, Dr. Jen Ashton. Jen, great to see you. So there are these new findings on COVID-19 in pregnant women. What can you tell us about that?
Well, Dan, the CDC released the latest numbers of this very specific population. We know that pregnancy is a condition where the immune system is suppressed. It's important to remember that every pregnant woman really represents 2 patients' lives that we have to worry about. And in general, they're more susceptible to infectious respiratory diseases. So the numbers from the CDC thus far on COVID-19 and pregnant women, 11,312 cases, more than 3,000 hospitalizations, and at this point, 31 pregnant women have lost their lives due to COVID-19. So recent data from the CDC does suggest that they're more at risk for hospitalization, ICU admission, not really at increased risk of death, but every single death in a pregnant woman has a major ripple effect for sure in their family.
Absolutely. Another headline this morning, the World Health Organization acknowledging the possibility that COVID-19 can be transmitted indoors by aerosol particles that linger in the air instead of falling to the ground, as we may have thought at the beginning. And Dr. Fauci is now saying that aerosol transmission is likely to some degree. So what are the implications here?
Well, there are implications, Dan, but it's important to remember that when people hear that headline, which can be frightening and scary, according to aerosol scientists and infectious disease specialists, the difference between aerosol and airborne and respiratory droplets is really based on semantics. It's about how large those particles are, how far they can travel from the infectious source, and how long they can linger in the air. So when you talk about implications, particularly for indoors, it may be how far apart we're suggested to be from each other. It may be potentially down the road masks indoors. And there are people looking at possible transport of these particles via air conditioning systems, although that is really not firmly proven at this point. So scientists working at the biology, physics, and chemistry of how these viral particles move.
Yeah, implications for schools, for offices, for bars, for movie theaters, anything that's happening inside. Of course, that's a huge chunk of our economy. Dr. Jen, great to see you on a Saturday morning. Really, thank you very much for getting up with us.
Thanks, Dan.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.